I came to Duke in 2005, and it was after my career at Vanderbilt, where I did some academic things. But then after the passing of my wife, I went into private practice, and I got a lot of experience in the business of medicine. That was severely lacking when I was at Vanderbilt. So by the time I came to Duke, I had some modest experience in the business of pain medicine along with the academic portion. So I was able to use those two components and try to bring Duke to where I think they ought to have been. When I came to Duke, I had already been in academic medicine for 24 years, so I sort of came to Duke on the latter half of my career. While I was at Vanderbilt, a couple of things that I was most proud of was the establishment of the first pain clinic in the state of Tennessee. I also published a textbook on cancer pain, which at the time was the second textbook on cancer pain in the world, and I was quite proud of that. One of the things I like a lot about Duke was the freedom to explore not just scientific and academic things, but also procedural things. And we'd like to give credit to our chairman, Dr. Mark Newman, for his support. And we changed many things in our approach to evaluating patients, triaging patients, and in the procedures we offered patients. But probably more importantly, we really strengthened the pain fellowship program. Initially, we could barely get one of our anesthesia residents to do a fellowship in pain. By the time I left, at least 6 were wanting to do pain at any one time, which was phenomenal. In 2004, Queen Elizabeth II of Great Britain awarded me with the Companion of the Most Distinguished Order of St. Michael and St. George, so-called the CMG. And that was given to me for my work over the years. At the time I was president of the World Society of Pain Clinicians. And one of the things I did as president was to establish 6 vice presidents in underdeveloped regions in the Far East, in the Caribbean, in Eastern Europe. And that probably, one may modestly say that, may have been the catalyst for the proliferation of pain clinics around the world. That was done in about 1996. When I went to London for the award, I did not meet the Queen, but the award was given to me by her son, Prince Charles, the Prince of Wales. And fortunately afterwards, I had an interview with Prime Minister Tony Blair, and he entertained us at number 10 Downing Street that same morning. Well, I have a wife, that's Nalita. Nalita is my second wife. We have 3 children, Wayne, who is 41, Wendell, who is 39, and Sharon, who is 36. I have 3 grandchildren. I have 2 girls and a boy, Ariana, Jasmine, and Jack. When I retired in July of 2011, I did nothing for 15 months, other than playing golf. And so this was getting to be a bit much, so I went back to work 2 days a week. I started doing something, initially I thought it was temporary, but I'd probably do it for a little longer. I'm treating drug addicts. In the pain clinic at Duke and in other pain clinics, when people violate their narcotic contracts, you kick them out of the clinic, you sort of discharge them. And we don't know what happens to those people. Some of them end up dead, some of them end up in prison, and some of them could be our neighbors, our families. And so as I treat those people, it's like coming full circle. So I find that very rewarding.